As glaucoma progresses, many patients eventually reach a point where medications and even earlier interventions are no longer enough. We increase drops, we repeat laser, and yet the pressure remains above target. The challenge becomes clear. How do we lower pressure further while still preserving safety and physiologic outflow? Today, we're going to discuss iStent Infinite and how expanding trabecular bypass can play an important role in managing refractory glaucoma within the interventional glaucoma mindset. Hello, I'm Dr. Constance Okeke, and welcome back to the Interventional Glaucoma Tool Chest. This editorially independent educational series is supported by Glaukos, iEntric, New World Medical, and Sight Sciences. What is iStent Infinite? iStent Infinite is a trabecular micro-bypass system designed for patients with glaucoma who required additional pressure lowering despite prior treatment. Unlike earlier trabecular stents, typically placed during cataract surgery, iStent Infinite is intended for standalone use in patients with more advanced or refractory disease, though it can also be performed in conjunction with cataract surgery. The device is made of implant-grade titanium, allowing long-term biocompatibility, and is MR conditional for use under specified MRI conditions. How it works. The goal is simple: restore physiologic aqueous outflow. The device bypasses the trabecular meshwork, allowing aqueous humor to access Schlemm's canal more effectively. 3 stents are implanted sequentially, typically across the nasal angle, ideally spaced across approximately every 2 clock hours to access multiple collector channel regions. Note, I have inserted the stents in other locations like inferior or temporal when moving my surgical chair and approach to access other angle areas. Here is a visualization of implantation showing sequential placement across the nasal angle. By recruiting more outflow pathways, resistance is reduced and pressure lowering becomes more durable. Who is iStent Infinite for? Patient selection is critical. iStent Infinite is not simply an extension of iStent inject candidacy. This procedure is intended for patients with refractory glaucoma, failed prior medical therapy, and surgical failure. Contraindications and safety considerations. iStent Infinite is not appropriate for all patients. Contraindications include primary angle closure or narrow angles not surgically opened, active uveitis, neovascular glaucoma, acute traumatic or malignant glaucoma, congenital anterior chamber anomalies, conditions causing elevated episcleral venous pressure, such as retrobulbar tumors, thyroid eye disease, or Sturge-Weber syndrome. Proper gonioscopy prior to surgery is essential to evaluate for peripheral anterior synechia, rubiosis, angle abnormalities, and visualization adequacy. Setting up for success begins before entering the OR. Clinical case combined strategy. Let me share a case that illustrates how this fits into real-world care. This patient was pseudophakic with multiple systemic limitations affecting medication options, including sleep apnea, asthma, and sulfa allergy. He had previously undergone SLT, but continued to have uncontrolled pressures of 27 and 29 with a target in the mid-teens. He was only able to tolerate Alphagan 3 times daily. As medical options were limited, we pursued a combined interventional strategy using iStent Infinite together with iDose TR. Postoperatively, both eyes achieved pressures of 16 millimeters of mercury. Medication burden reduced from 3 times a day to 2 times a day on Alphagan. Stable control without escalation. Durable pressure reduction, meeting target goals. This case highlights how combining sustained drug delivery with expanded outflow intervention can help patients who otherwise have limited pathways forward. Clinical Pearl. One important lesson is this: refractory glaucoma doesn't always require jumping immediately to filtering surgery. Sometimes expanding physiologic outflow, especially when combined with other interventional tools, can achieve meaningful pressure reduction while preserving future options. The key is identifying patients early enough to intervene thoughtfully. integration into practice. Successful integration comes down to recognizing the right moment. Ask yourself, has first-line therapy truly been optimized? Is pressure still above target? Are medication options limited? Can we intervene before conjunctival surgery becomes necessary? When those answers align, iStent Infinite becomes a powerful option within the interventional toolbox. If you'd like help explaining iStent Infinite to patients, I've included a free downloadable patient discussion guide in the description box. You'll also find related educational resources, including MIGS Success Surgical Secrets, MIGS Inside the OR, and MIGS in Minutes, where you can watch step-by-step implantation techniques. Subscribe to the iGlaucoma YouTube channel so you don't miss upcoming episodes. In our next episode, we'll continue building the Interventional Glaucoma Tool Chest as we explore another approach to intervention, helping you continue developing the interventional glaucoma mindset. Because when we shift our mindset earlier, we change outcomes.